All right, well, looks like we've got a good group here with us. So thank you for joining us for our webinar on support for breastfeeding and lactation. We're here with Dr. Katie Ouillette-Harrington, who is a doctor of physical therapy, a pelvic health specialist, a pregnancy and postpartum corrective exercise specialist. She's got some other things that are less relevant for this topic, but she's also in the process of becoming a lactation counselor. So she's got some great training on breastfeeding. So this is the first time we've had this topic, but we're excited to share some ideas to prevent pain, injury, dysfunction during breastfeeding. So for those who are here with us live, you can click the Q&A button at any time to submit a question anonymously, and then Dr. Katie will answer those at the end. So feel free to do that if you have a question pop up. But with that, I will turn it over to Dr. Katie.
Thank you. All right, thank you everyone for coming. I am excited to present on this topic today. So our objectives here are to understand the anatomy and function, that's supposed to say functioning, of the lactating body, learn the benefits of breast/chest feeding, learn how to establish lactation successfully and have a positive feeding experience, discover different feeding positions, learn how to manage clogs and mastitis, and then learn tips to improve comfort and decrease pain while breast or chest feeding. So I won't go in significant detail through my professional background. Kate touched on a lot of those things, but I've been learning for a long time. So my personal background, I live in Midland with my family. We are avid hikers, campers, all the outdoor things. I'm a runner, and then you also see our dog pictured up there. So let's get into it. So anatomy and physiology of the breast. So our glandular tissue is what makes the milk. This increases and grows during pregnancy, and then groups of that tissue forms the lobules, as you can see here, those little pink things. The milk travels through the milk ducts out into the nipple, and then there are also glands over the areola, which is the darker tissue, that secrete oil that has antibacterial properties. So you don't want to wash the areola or the nipples with soap because we really want to make sure baby is getting that. So some terminology. Colostrum is a yellowish, protein-rich, antibody-filled milk within the first few days to weeks after birth. Mature milk comes in around 5 to 7 days, and that can vary. Sometimes it's earlier. Fore milk comes out in the beginning of the feed. Hind milk comes out at the end of the feed, and this is higher in fat. Engorgement is a feeling of fullness in breast that can happen anytime during breastfeeding, most common in the first 36 hours, because that's when your milk is generally starting to establish. And then cluster feeding is several feedings happening close together. So if you've already had a baby, or you're in like that first few weeks to months when the baby is feeding, sometimes every 20 minutes to an hour, and you feel like you might be losing your mind, that's cluster feeding. So body changes during pregnancy in regards to hormones. So estrogen increases in pregnancy to stimulate growth of the ducts, which is where the milk travels. The human placental lactogen, that stimulates growth of breasts and the nipples and the areola. Progesterone increases in pregnancy, and that's to help get milk started. After the birth of the placenta, the progesterone decreases, and that helps milk come in. Prolactin is specifically for milk production. This increases in pregnancy to increase the breast tissue, so there is the ability to produce milk. It follows your circadian rhythm, so it changes throughout the day based off your sleeping. And then this will increase in response to sucking, or like the baby suckling at the breast, or pumping. And then increased levels of this does delay ovulation. And there's oxytocin, and this causes muscle contractions in labor, so muscle contractions of the uterus. And this is also triggered by sucking, and it helps squeeze the milk out. And that's what gives you that feeling of like euphoria, happiness, calmness as you're breastfeeding. So benefits of breast and chest feeding. So there is immune support for baby. So the amount of what we call passive immunity, because it's not being created by the baby, given through the milk is dose dependent. So the more milk they get, the continuing passive immunity they will get. So there are things in the milk that help attack pathogens, so bacteria and viruses. It can combat E. coli, Candida. It also keeps pathogens from burrowing into the digestive tract, which is where this gut protection comes from. In the early weeks, there's what's called like a wide junction in the gut, and that it's to make digestion easier on their small little tiny new bodies. But there is an increased chance of absorbing pathogens because of that wide junction. So as breast milk goes through the digestive tract, it actually coats this so pathogens can't enter. And even one bottle of formula can change the baby's gut bacteria for up to a couple weeks. So there are also components of the breast milk that helps clean out bacteria and waste products in the bloodstream, and it can fight respiratory infections. There's anti-inflammatory or antioxidant properties of milk. Breastfeeding helps decrease the risk of SIDS, and it can help with bonding. So contents of human milk. We have mostly made up of water, so that's how babies get their hydration. Half of the calories are coming from the fat, and we have a couple of fatty acid chains, the DHA and the AA, and there's more fat at the beginning of the feed. Sorry, at the end of the feed. And so the DHA and the AA, they are essential for many physiological processes in the human body. So this is like brain development, eye development, immune system support. The DHA and such that's added to the formula, there's a question of safety because it's not really regulated and we don't know how well it's absorbed into the body. So that's why the fat that's naturally in human milk is better than the stuff that they're adding to the formula. We have protein that's higher in the colostrum, or the milk that's coming out right at the beginning. And there's a lot of vitamins and minerals in milk. What you're eating in your diet will not affect the content of the vitamins and minerals in breast milk. Your body will find a way to put it in the milk. With that being said, that's why it's important for you to eat a balanced diet and continue postnatal, prenatal vitamins postnatally to make sure that you have enough stores for your own body. So going over a couple of feeding cues to know when your baby is ready to eat. Rooting, or where they kind of move their cheek. If you brush your hand on their cheek or their breast on their cheek, they'll move towards that. Wriggling, so having the little wiggles. If they're sucking on fingers, clothing, or a blanket. Fussing, restlessness, squeaking noises. And if they're crying, it sounds like a neigh, or like neh, neh. If you look up Dunstan baby languages, there's like 5 different baby sounds within the first like 2 months that tells you what your baby needs. It's really cool. So establishing lactation. So it's important to nurse right away after birth. It's easier for baby to learn how to latch when the breast is soft before that milk comes in. Breast needs to be stimulated to make milk for later. So the beginning of lactation is hormone dependent, and that hormone's released when baby latches. So the earlier the latching, the more milk you'll produce. So in the first couple months, that's when that production is hormone driven. So you need to feed regularly, and I put in air quotes with completely empty. We'll get to that later. Feeding 8 to 12 times in a 24-hour period is normal. Skin to skin. So when you're bare skinned and baby's bare skinned, that helps release oxytocin, and that helps baby find your breast. So other things that are beneficial for establishing lactation: hold the baby as often as you want. Again, it helps establish a bond and getting to know your baby. Your innate and intuition is important. So if you feel like you need to hold your baby all the time, don't listen to what other people say that you're spoiling your baby, because you can't spoil a baby. So feeding patterns evolve from day to day, week to week, even hour to hour. So you don't have to stay on a strict schedule. Follow your baby's cues, and again, follow your intuition. So with latching, you want to squeeze your breast first. Think of it like a big sandwich. So especially if you have large breasts, because that helps with baby as they're latching. So you would squeeze the breast in the same way you do before eating a sandwich. And there's a couple different ways that you can do this. So there's a C hold. The C hold, if this is your breast, looks like this. So you have a hand on the top and then fingers on the bottom. So advantage is it helps stabilize the breast. It's easy to point the nipple to the roof of the mouth. It's helpful for larger breasts. Disadvantages is when it's on you, you can't see your bottom fingers to know if you're covering too much areola. The V hold or the scissors looks like this. So advantages is it's comfortable for many. The disadvantages is the fingers that are less mobile. They can block milk flow if you're restricting and pinching off here. Fingers might not be able to spread wide enough depending on the size of the breast. And then the U hold is under like this. So this doesn't really have any disadvantages. The advantages are it's great for small and preterm babies. If the baby is in more of an upright position, and it can help latch because if sometimes if babies are weaker, you need to help support their chin and cheeks, and you can do that while also holding the breast. And again, when you are if you have to support your breast during a feeding, do so gently, so you don't want to squeeze hard because that can decrease milk flow. So with preparing to latch, make sure you're in a comfortable position, have anything you need close by. Definitely bring some water or something to drink. Sometimes with a letdown, which is once that milk gets flowing, you get really thirsty. So you're bringing the baby to you, not you to your baby. That will help a lot with what we call ergonomics or posture. So you're holding onto the back of their baby's head, not their occiput. So if this is the baby, my little crochet thing, their occiput is like, if you feel on your head, it's that really bony prominence in the back. So you don't want to hold on to that part. You can hold on to like the whole head. You can hold on to like the top of their neck. You just don't want to hold on the occiput. You want to get baby interested in the breast by brushing the nipple on their lips. You can also hand express a couple drops onto their lips and then wait. You want baby's mouth to open wide to get a deep enough latch. Like it's not this wide, like you're going to bite a big sandwich. And then from there, you're looking at nipple to nose, and the nipple's at the top of the baby's mouth. You want the nipple to point up towards here, and then from there, latching. So you want more of the lower part of the breast from the baby's perspective. So down here of the areola is taken into their mouth to form a teat. So your nipple will actually elongate in some part of the areola. You may have some pain initially with the latch, but there should be no pain that lasts during the feeding or afterwards. Sometimes people have pain with that letdown, which is once that milk starts to flow more steadily and the baby is getting a deeper suck. But after that, it shouldn't be painful. So this is another image of squeezing the breast, hitting the nose, and then you're inserting deeply, and how baby's mouth should be open wide, and make sure their head is free, and their head might need to be tilted back a little bit. And that's to get the wide and deep latch. Tips for latching success. So signs of a correct latch: the cheeks are rounded, not sucked in like they're sucking on a straw like this. It should be rounded. Baby's mouth should be between 120 and 160 degrees. Lips flanged out like a fish, so they shouldn't be pinched. You should be able to hear some swallowing. You don't want to hear clicking or smacking noises. When your baby comes off the breast, your nipple shouldn't be flattened or misshapen. If anything, it'll be a little bit longer, but it shouldn't look like lipstick. Chest against breast, so baby should be tucked into you. So you should feel a letdown at some point. Some people don't feel it. Some people do. It's like a tingling, like a burning. Sometimes they just feel like the breast is more firmly gripped. So they'll have quick sucks at the beginning to get that letdown. If you ever pumped before, the pumping is quicker at the beginning to stimulate the letdown. And then once that letdown happens, that milk starts to flow. the sucking is more rhythmic. Their hands and arms should be relaxed. Your breast should be, after they eat, the breast should be softer after a feed. And then if they have enough in regular wet and dirty diapers, you know that they're getting enough milk. So to unlatch, you don't want the baby to just like come off, because that's not great for your nipple. So there's a couple different ways to get them to unlatch. There's what's called kind of like the fish hook, where you put your handy dandy crochet baby out here. So you would put your finger in the baby's mouth to break the seal. So it's like a little fish hook. You can press the chin from the outside or press down on your breast before they come off. If you've ever had a baby come off without unlatching, you know how painful it is. Don't recommend. 10 out of 10. Don't recommend. So common breastfeeding positions. Laid back nursing position is great once your baby is newly born. If you're doing that laid back with the skin to skin, it's what's called biological nursing, and it releases 20 different reflexes that help the baby with breastfeeding, and it helps with milk production for yourself. There's a cross cradle hold, which is right in the middle. So baby is across you like this, and you're hanging onto them with so if like the baby is nursing on your left, you're hanging onto them with your right arm. There's the cross cradle. I think I got that mixed up. Nope, that's right. Sorry. And then there's the cross cradle where you're holding onto them with the same arm that they're feeding on. So if they're feeding on the left, you're holding onto them with the left. Football hold is they're in like tucked into your side, which is great if after you've had a C-section or if you're feeding more than one baby. And then there's the side lying position, which is also good after you've had a C-section, and it's great like comfort wise, and also great if you are co-sleeping. So if you're using pillows, they are to support you and not the baby. So that can also help with ergonomics. If you need to like rest your arm on something, so that way you're not like holding it up if you're doing the cradle, cross cradle football. Common myths of breastfeeding. A myth is that breastfeeding hurts. It shouldn't hurt. If something hurts, then something is not right. It might be the latch. Your baby might have a tongue tie or a lip tie. Like I said, it can hurt initially when baby latches, but then that should go away. Another myth is that breastfeeding is easy. It is not. It takes a lot to keep up with how often they're eating sometimes, especially with that cluster feeding. It can get really tiring waking up in the night to feed them. It's a lot of things with it can come naturally, but it doesn't mean that it's easy. So if you are breastfeeding, if you're planning to breastfeed, just know that and it is great and it's amazing. It's a great bonding experience, but there are also some hard things that come with it. Another myth is that breastfeeding parents need to change their diets. Like we talked about, what you eat doesn't really reflect on the contents of the breast milk. You just need to make sure that you are getting enough calories. So it's about the same as when you're pregnant. So I believe it's an extra, like on average, 400 to 500 calories per baby. Another myth is that you can fully empty the breast. There's always milk in the breast, even after you've fed for 20 to 45 minutes on the breast, did a full pump, there's still some milk left in there all the time. Another myth is that you can't get pregnant while breastfeeding. Although the hormones that are present decrease the chance of ovulation, you can still ovulate. So just because you don't have a period doesn't mean that you can't get pregnant. Another myth is that if baby is feeding a lot, that means the lactating parent has low supply. Again, we talked about the cluster feeding. That's completely normal. 8 to 12 times in a 24-hour period is normal. You know that you have enough supply if your baby is gaining weight, has enough dirty and wet diapers. Another myth is your baby should be on a feeding schedule. Again, follow their own schedule, follow their cues, and it's average 2 to 3 to 4 hours in between feeding, but that doesn't mean you have to stick to it. Baby should be weaned before their first birthday is another myth. Kate, have your hand up on purpose?
No, not on purpose. Sorry. Thank you.
Yes, no,
We're good. I just clicked it by accident.
okay. Your hand is raised. I just didn't know if you knew that. Okay. Babies should be weaned before their first birthday is a myth. New studies that are coming out through the WHO and CDC recommend up to 2 years. And then breastfeeding should be used to help you lose baby weight is another myth. I do not like the term baby weight. I don't like how society has led us to believe that we should be losing this weight and getting back to our pre-pregnancy size. You just grew a human for 9 to 10 months. You are now feeding that human. Let's not focus on what our body looks like. I know that it's very hard. But let's just focus on the miracle of life and that you did great things. Okay, so common complaints that happen with breastfeeding are sore nipples, a poor latch, clogs and mastitis, low supply, oversupply, breast or chest refusal, neck, shoulder, back pain, and then a lot of times we get what's called thoracic outlet syndrome, which can also happen during pregnancy. So you can have, that's where the nerves, arteries, and veins get kind of like pinched off underneath the collarbone because there's a lot of muscles that go through here that can get tight. So if you see this pattern here, people can have altered sensation or pain in this area. So if you ever like fall asleep on your back and your arms are up like this and your whole arm kind of feels like it's going numb, that's a symptom of thoracic outlet syndrome. Sore nipple solutions. Latch is super important. If you're not sure if you are having a good enough latch, definitely see a lactation consultant. You can always hand express before breastfeeding to help with the letdown if the letdown is painful. You can moisturize your nipples in between feeding, wear comfortable cotton bras, and then also allow exposure to air. Nipples should not be bleeding or cracked. Treating clogs and mastitis. So a clog, as you see here, this is mastitis, but a clog is like a hard sore lump in the breast. Mastitis is swelling, redness, warmth, and pain. It can happen after a clog and when there's can be an infection. So that lump can become hot. There can be red streaks and you could get flu-like symptoms. So with treatment, you want to do a cold compress to help with the inflammation, gentle massage. So if you look up on YouTube, massage for mastitis or massage for clogs, they'll walk you through a great thing that you can do on your own. Another thing is breastfeeding on all fours. If you have a clog, that can help draw that out. I know it sounds weird and it can probably be uncomfortable, but when you're desperate. And then ultrasound and kinesiotape can be done by some occupational and physical therapists to help relieve that. Mastitis can be caused by a poor latch, so that's why you want to make sure you have a good latch. Clogs can cause mastitis, and then poor emptying. So if your breasts aren't getting enough out, that can cause it. So how can therapy help with this process? So we can teach you ergonomics or good posture, exercise in different modalities like ultrasound, massage, and stuff for pain relief, and then ultrasound and taping for the clogs and mastitis. And then I'm going to reverse it up back for a second. So the common complaints, some of these, if you have concerns of them, you should go see a lactation consultant. So the low and oversupply, breast chest refusal, stuff like that, that'd be great to see a lactation consultant. If you need to find one, you can email me after and I can help you get set up with that because I know a few really good ones. Okay, so coming back to how therapy can help. There's some exercises that you can do. As a side note, I'm going to get a handout put together for this to be emailed to you guys after the presentation is over. It won't go out immediately, but when you guys get the recording for it, it should come along with that. So open books are in this top thing over here. So you're laying on your side, arms are on top of one another, and you're opening up here. And then we have a doorway pec stretch. So elbows and shoulders are at 90 degrees. You're coming into the doorway and stepping through. You should feel great stretch through right here. As you know, with pregnancy, with holding your baby and breastfeeding, we're always rounded out here, and that's what can cause a lot of pain. This stretch up here is to stretch these what's called upper trapezius. So if you sit on your hand of the side you're going to stretch, you're going to gently pull your neck to the opposite side, letting that shoulder drop. And then you can even rotate your head down to get another part of the muscle. Again, instructions, reps, sets, hold times, that'll all be sent after. This in the bottom left is called a supine angel. So you're laying on your back, arms are coming out to the side like this. You're going to come up and down like you're making a snow angel, really pinching those shoulder blades together. And then we have cat cow. So you're on all fours. You can tuck your head around your spine as you're breathing out. Lift your head, arch your back as you're breathing in. So as you bring your belly button to your spine, you're breathing out. As you're dropping your belly button to the floor, you're breathing in. Some more exercises you can do. Pinching your shoulder blades together. Making sure your shoulders are staying down. So when you pinch them together, you don't want your shoulders to come up. Which is another thing as a side note to pay attention to when you're feeding. I did this a lot. Even though I teach things what not to do to cause pain, I still did it when I was breastfeeding my daughter. But a lot of times when I was holding her, I would lift my shoulder up like this, and I was like, geez, that's getting sore. And then I like tune into my body. It's like, oh, that's because your shoulder's in your ear. So make sure you're relaxed down as much as you can. I know it's hard, especially if they have trouble latching, like you get them into a position and you're like, finally, this is going well. And you're like, I don't want to move. Totally understand that, but it's just something to keep in the back of your mind. And then this one here can help with neck pain. So this is called a cervical retraction. And I'll turn to the side here. So your chin is coming back, like you're going to be giving yourself a double chin, and it's coming straight back, not down. So your eyes should stay in the same spot, looking straight ahead. And then this bottom one is the prone I, T, W, and Y. So you're laying on your stomach. First one is the I. Arms are straight up overhead. You're pinching those shoulder blades together and your arms are lifting. A T is your arms out to the side. Thumbs are up towards the ceiling. You're lifting your arms off of the floor. W is kind of like that supine angel position. So elbows are out to the side, bend at about 90, shoulders at about 90. And then you're pinching those shoulder blades together, lifting your arms off the floor. And then Y's, like you're doing the YMCA, lifting up there. All right, so with pumping, you want to continue to, air quotes, empty, because we can't fully empty the breast, 8 to 12 times a day, as a baby would naturally feed. So just like a baby would naturally feed, you want to start off, and some of these pumps, depending on what you're using, have these settings already, but just an FYI, you start off with the faster sucking to get the letdown. Once that milk really starts coming out, then it's a slower, deeper suck to get that milk to draw out a little better. You can alter these settings to have more than one letdown in one session. So that can help you, that helps with your milk supply. That also helps with building your stash of milk. So if you're breastfeeding and pumping and your baby gets a bottle, you want to pump at that bottle session. It doesn't have to be the exact time, but since they're getting that feeding instead of your breast, you want to make sure that you're getting milk out, because that can cause engorgement, clogs, mastitis, but it also helps protect your milk supply. So different locations for pelvic floor therapy. We have Bay City, Bridgeport, Carroll, Frankenmuth. I'm in Midland, and then we have Saginaw State Street. Do we have any questions?
Thank you for sharing this. We didn't have any questions live. We did have one from the registration asking for postpartum exercises that you can actually do while watching a baby. I know you went over a few great stretches there, but just wanted to see if you had any tips for people on exercise while a baby is also in the room.
Yes. Also, I just realized that I had my computer muted, and when you were talking to me earlier, that's why I couldn't hear you. So I apologize.
Oh, okay. Yeah, I just accidentally raised my hand.
Oh, okay. All right. So exercises to do with a baby. Okay. So any of the things we talked about here, a good one to do is really activating those abdominal muscles. So with pregnancy, those abdominal muscles get really stretched out. With the C-section, they will get inhibited even more. So if you imagine there's a string connecting from one hip bone to the other hip bone, you're tightening that string. So it's easy to do with a breath out. So if you breathe in deeply, as you're breathing out, really think about drawing that belly button in, drawing that string together. You don't want to squeeze so hard that you're like flexing your abs, like your pelvis shouldn't move when you do this. And you don't want your stomach muscles to bulge out. So that's a good thing to just activate those stomach muscles. There's a bunch of different exercises that you can do when we're actually working on getting handouts, free handouts for you guys to look over, and there's going to be different levels. So more to come on that, but that's an easy one to do. You can do squats, lunges, as long as they feel okay, not causing pain, not causing leakage, and not causing feelings of like pressure or heaviness, or that something's falling out of the vagina.
Sounds good. That's great. I think a lot of new moms especially feel like they have to be working up a sweat to be doing anything beneficial, but there's so many of those little things that can really make a difference. So thank you for sharing that. For everybody who registered, you're going to receive a follow-up email with a link to the recording. A few people weren't able to join us live today. And we'll make sure that any handouts that Dr. Katie wants to include are there. It will have her contact information and also some links to other places where pelvic floor therapy is held. So thank you again, Dr. Katie, for always sharing with us. We appreciate you so much.
Mhm.
Thank you. Bye, everybody.
Yeah. Bye.